Hi, this is Dr. A, bringing you your last video in the muscular system. We're going to go over diagnostic and therapeutic procedures. All right, for diagnostic procedures, we have a clinical lab test. It is called a creatine phosphokinase or creatine kinase, often referred to as CK, total CK, or CPK. It is a muscle enzyme that's found in the skeletal and cardiac muscle. And elevated blood levels will indicate muscle damage. It is seen in muscular dystrophy and heart attacks. This is the enzyme in the muscle that allows for the storage of ATP as creatine phosphate. So it's involved in energy use and production in the muscle. So let's go over some diagnostic procedures. So we have deep tendon reflexes, or DTR. It is a muscle contraction in response to a stretch. It is used to determine if the muscles are responding properly. An electromyogram is a hard copy record that is produced by an EMG, and an EMG is electromyography, which is the study of the strength and quality of muscle contraction in response to electrical stimulation. So that's where we go. We have the electrical, the electro, myo for muscle. And then graphy is always the process of recording, and gram is the actual recording. A muscle biopsy is the removal of muscle tissue for examination. So biopsy is always going to be viewing or examination. Activities of daily living, or ADLs, are activities that are typically performed in a normal day, like dressing and washing and eating. And if somebody needs help with the activities of daily living, this would be the realm of occupational therapy. Cryotherapy is cold treatment. Gait training is assisting a patient to learn to walk again, or teaching them to use assistive devices to walk, such as a walker or a cane. And they usually have a gait belt on, and somebody's holding and supporting them as they learn to walk again. And hydrotherapy is the application of warm water as therapy. Massage is kneading or applying pressure by hand to promote muscle relaxation. Mobilization is exercise, massage, and physical manipulation to restore movement. Passive range of motion is putting a joint through the range of motion without assistance. So this is where the therapist takes the joint and moves it in the range of motion, and the patient doesn't do anything, okay? Which would be then opposite to active range of motion, where the patient is helping move the limb in, or the joint in the full range of motion. Phonophoresis is the use of ultrasound waves to introduce medications across the skin. So phoresis means to carry. Phono is sound, so it's sound carry is what it means literally. Therapeutic exercises are an exercise plan and carry out to achieve a physical benefit. Usually is to restore movements or use of limb or the body in some way or another. Thermotherapy is application of heat as therapy. Ultrasound therapy is the use of ultrasound waves to create heat in soft tissues under the skin. Carpal tunnel release is a cutting of the ligament in the wrist to relieve the pressure that is caused by carpal tunnel syndrome. Fasciotomy is surgically cutting into the fascia, which is the wrapping around the muscles. Myoplasty is the surgical repair of a muscle. You would do that if you had a torn muscle. And myography is the procedure to suture together a muscle, which might have to happen if your muscle is actually torn. Tendoplasty is a surgical repair of a tendon, and tendotomy is a procedure to cut into a tendon. Tenodesis is the surgical stabilization of a joint by anchoring down tendons of muscles that move the joint. So desis means to fuse. Tenoplasty is a surgical repair of a tendon, and tenography is a procedure to suture together a tendon. And then in pharmacology, we have skeletal muscle relaxants, and they relax the skeletal muscle to reduce spasms like Flexeril or Soma. And so that wraps up all our diagnostic procedures and therapies for the muscular system. Thank you so much for your attention.